Welcome, everyone, and thank you for spending the next hour with us. I'm Nicole Hampy, and I lead the practice development team at R2 Technologies, the company that makes the Glacial Rx platform based on precision cooling. We've got a fantastic program planned for you today, going over best practices, tips, and techniques for using Glacial Rx, featuring two of our very experienced providers. The first speaker up is Andrew Licio. Andrew is an aesthetics expert with over a decade of experience in the industry. He is currently the business development manager at Beata Advanced Aesthetics in New Jersey. Andrew has been involved in launching several med spas and assisting physicians in the transition of medical practices from insurance to cash pay models. Andrew is certified in 20 devices and is an accomplished speaker and clinical educator. We will have a Q&A session for Andrew at the end, so please enter any questions you may have into the chat feature at the bottom of your screen. Welcome, Andrew.
Thanks for having me, Nicole. I appreciate you guys having me. I'm super excited to talk about Glacial Rx and how we've kind of incorporated it into our practice because we've been loving it so far. So I'm going to talk a little bit about the glacial gloss treatment. It's a no downtime anti-inflammatory treatment. You're going to get immediate, ongoing, and cumulative results with it. It's definitely become quickly one of our patients' favorite treatments in the office, not just on its own, but definitely in combination with other things. Just a quick little rundown of the gloss treatment. You're going to cleanse their face, use a peel that comes with the Glacial Rx back bar, a microdermabrasion type of tip. Then you're going to do a mask and your moisturizer afterwards. Obviously, you're going to finish that off with whatever kind of SPF you use in-house. But like I said, we kind of customize it a little bit more. We actually make our treatment a little bit longer than the standard. You can probably finish this in about 30 minutes. But we make ours about 45 minutes to an hour, and we actually will incorporate some red light therapy, neck and arm and shoulder massage, something like that, just to bring it a little bit more spa-like as well. But it's a super comfortable treatment, and we've been getting great results with it. So I'm just going to talk a little bit about some of the results as far as the gloss treatment goes, but then how we can kind of incorporate those into our practice. So obviously you get that whole cleanse, peel, exfoliate, and hydrate. One of this patient right here is actually one of my neighbors. And she comes in, she's a busy mom of three. And she doesn't really do a lot for herself, but she's scared to do things like Botox fillers, like the more invasive type of treatments. So I thought Glacial Rx would be a great starting point for her. And this is immediately after one treatment. So you can see you get that reduction in inflammation, which helps to kind of cause those wrinkles, the 11s as we call them. And hers are actually more significant even at rest. So you can see that she got a great result just from this one. This next patient is actually my mother-in-law. She comes in again on a regular basis. She does not like things that hurt. But one of the reasons why I chose Glacial Rx for her, and specifically the gloss treatment, is because she does like to do more aggressive things on a regular basis, like chemical peels, microneedling. She'll occasionally do some laser. But back in October of this past year, she actually got shingles and was in the hospital for about a week and a half. Not fun, obviously. She recovered very well, but the problem was she was scared to kind of come back into the office because she actually had a lot of itching behind her right eye, which was just like something that stayed along after her shingles had gone away. So I said, hey, you know what? Why don't you come in? We'll do a gloss treatment. And I think that'll make it better because the whole premise behind Glacial Rx is the fact that it is helping to relieve inflammation and stress within the skin and body. So she agreed because, again, she was nervous, and she's my mother-in-law, so she doesn't always like to listen. But but she came in, and actually after that treatment was the first time since October. And when she came in, I believe it was the end of January. Uh, she had said it was the first time since October that her eye was not itchy, which I thought was pretty incredible. And honestly, I didn't know if it was going to work or not, since we did just get our Glacial Rx device. I believe it was December, so it was still relatively new to us at that point. So we didn't really know all of the capabilities. So we were having people come in for facials. We were doing our glide treatments after ablative treatments and stuff like that as well. But so incorporating this as that stress relief and inflammation relief as well for her, I wasn't really knowing, but I just kind of assumed that it would be good. And I mean, it lasted about a month where there was absolutely no itching. We had her come in, do a second one, same kind of result. So I'm hoping that with the third one that we do, it kind of subsides it all, and we're in a good place for quite some time. This next patient, the reason why I wanted to kind of talk about her, she actually came in like the picture on the left. She was getting topical Tazorac from her dermatologist, and clearly she was using a little too much. She wanted to come in, and she was going to get a resurfacing laser treatment. She was not normally this red, so obviously I didn't want to do that laser treatment because she's already irritated. So she wanted to do something. I was hesitant to really do anything, but I ended up doing just a gloss treatment. And as you can see, even with the blemish that's on her forehead, that calmed down a lot. I wasn't quite sure what was going to go on with her face. I was hoping that it would calm it down a little bit more than what's pictured on the right, but she was happy. It was definitely much more relaxing for her. Her forehead lines are obviously a lot softer, and she went home. So I figured it would help. Wasn't sure how much. About 6 hours later, she texted me and was like, I don't know what you did to my skin, but I am so happy. Thank you so much. You're a magician. So this is her about 6 hours later. So the blemish is gone, the redness is gone. Again, I like coming into this industry. I've been doing this for 10 years, a little over 10 years now. And you hear about these cryo devices and stuff like that. And I feel like a lot of it in the past was a lot of hype. And even when we brought on Glacial Rx in the very beginning, I was a little hesitant because I didn't know how it was going to get placed in our practice. I didn't know how much science was behind it. And coming to realize all the different white papers and research that you guys really have put into it it was great. And then I honestly keep getting surprised every time I use it because people continually will get better and better and better results. So I've been really happy with it. Like I said, we do this as a standalone treatment just because it is super cost effective. It works well as we do a package pricing and we have a monthly membership. So we kind of incorporate it into both. But again, like I said, you can definitely customize and make it your own. Like I said, we have ours a little bit longer. We also do a shortened version, which we include in our lower tiered membership. And it really is that and treatment, so to speak. Anything that you have in your practice, we've been able to to incorporate it. So whether or not we're doing RF microneedling, obviously we're probably going to hold off on the chemical peel portion of it. But that's what I mean when you can customize it and make it your own. So as you add it into those other treatments, I've done it with like a laser genesis type of thing, where it's a laser toning and there's really no ablation. You're just collagen stimulating. Any kind of ablative laser treatments, we do it with dermaplaning. We've incorporated it with hydrofacial. So it really is that and treatment that you really can just customize however you want. Whether or not you're using the full gloss protocol, that's up to you. But like I said, you're able to customize it whether or not it's using the products directly from Glacial Rx or finding products that you want to use. Like we use an anti-inflammatory line that we carry as well, and we sell retail. So we'll use that with certain parameters as well. So like if we're doing a more ablative treatment, it is a product that's safe, that I know is safe for post-procedural like that. So we use that because then we can also sell that to our patient as well, and they can use that more on a long-term basis. So you really can customize it however you want, and that's something that we've been really happy with, just because, I mean, you purchase a device or you check out a device, even that alone, and you're never quite sure sometimes how it is going to fit into place. And this really has just become our go-to, whether it's me or one of our two estheticians, or even the doctor. The doctor was actually, again, he was one of those very skeptical people, and then when he started using it, he was blown away. So adding it into even the more ablative treatments that we do, he's been really happy with it. So I feel like everyone at our practice really uses it. It's not just one or the other. Um, Something else I kind of like to talk about is just consultation, just because a lot of people are a little hesitant or nervous because they don't want to feel like they're selling or something like that when it comes to consultation. So one way that I like to start it out is just listening. Like, what can you do for your patient? Yes, you want to talk about what you're able to do, but you want to listen to them first. So what do they want to improve, enhance, or reduce? I don't like always saying, hey, you know what I can do is get rid of all this sun damage and these wrinkles and the redness. You want to know what they like about themselves, because hey, you know what, if you like your eyes, let's enhance those eyes. And by doing that, we can help kind of maybe reduce some of the crow's feet or the pigmentation, so you can really focus on those eyes. But if you listen to them, you're going to really feel where their heart is and what they want to accomplish. And if you are able to do that, you're going to go a lot farther and have that person really give you that lifetime value of a patient that you're looking for, versus those patients where their lifetime value is anywhere from like $3,000 to $5,000. I kind of pride myself that our patient's lifetime value is upwards of $40,000 because they're coming to us on a regular basis. So once you listen to them and kind of see what their journey is, you can kind of incorporate what you want to address as well. And at that point, go over their treatment options and address those specific concerns. But you also want to create that custom treatment plan. It may not be 3 glacials in a row or 3 laser treatments in a row. Glacial Rx, like I said, is that custom kind of treatment, and you can incorporate it into your treatment plans. So for us, I tend to, if I'm going to do a more aggressive treatment, whether it's like RF microneedling or some kind of ablative laser, I definitely want to include some kind of Glacial Rx treatment, whether it's a gloss or a glide. We tend to do a lot more gloss treatments at our practice than glides, but however you see yourself doing it. Like when we have our packages, we'll do our more aggressive type of treatments. And then, yes, we want to calm down a lot of the inflammation, suppress those melanocytes, and continue with promoting good skin health. And whether or not that's reducing the inflammation in the skin, or as well as kind of prescribing pre and post home care, that's what's really going to give your patient that full, well-rounded experience. And it is an experience when they come into your practice. You want them to be able to come to you, ask you questions, and be able to trust you. And then specifically, I love being able to follow up with patients, whether or not that's a simple phone call or already scheduling a follow-up visit. You want to make sure that they're following directions, both pre and post care. And you want to make sure that they are coming in for that follow-up visit at some point, whether it's for pictures, to continue with treatment, or just to have them come in for a simple facial or a glacial RX gloss treatment. I like to actually get a little bit more personal. I tend to send out these handwritten thank you letters or thank you cards rather. And that's even if they don't purchase a treatment, a package or a membership, and they're just coming in for a consultation. I find that that goes a lot further. And when they see that in the mail, they say, "Oh wow, this person really took their time." And 9 times out of 10, those are the people that tend to come back if they decide not to purchase right then and there when during their consultation time. So it's time. I would love to open up for a lot of questions. Obviously, we don't have too much time for that. But so Nicole, you let me know what we got.
Thank you so much, Andrew. That was fantastic. We do have a few questions that showed up here in the chat.
Awesome.
The first one is, since Glacial Rx is a new category, what verbiage do you find works best when positioning the treatment to your patients?
Let's see. I mean, I try to not use that whole cryo type of terminology because I feel like at this point, it almost has like a bad rap to it just because of the fact that, I mean, there's some things that are cryo and work, I think. Um, one being this, obviously. But I like the booths and stuff that you go into. So cryo is fine, but I prefer the terminology like precision cooling, just because people can kind of understand it in a better way. Where you're kind of saying, "Hey, you know what? This is getting to specific temperatures because we're trying to target specific things versus just cold feels good."
Also, how successful have you been in transitioning your skincare patients to purchase glacial gloss treatments?
Actually really successful. So even the people that just come in for standard hydrofacial or hands-on European style facial, once you kind of tell them that capability of, hey, you know what, we're going to try to address the underlying inflammation in your skin. The nice thing is we have a very unique practice in that we see mainly regular patients. We don't do, I don't want to say we don't do a ton of new business, but a lot of our business is based upon referrals. So all of our new patients tend to be referrals. It's not just people Googling and calling around to see what a deal is. It's regular patients. So most of our patients will come in, they'll get a treatment, and they'll say, "What am I doing next?" So at that point, we usually say, "Hey, you know what? We got this really great device in. It's called Glacial Rx, and we're going to actually help to kind of address some of the underlying inflammation that you might have in your skin." So we may do 3 treatments, we may do 2, we may do 1, and then we kind of rotate it based upon what, again, what their skin journey, quote unquote, would be. So if they're kind of looking more for pigment, yeah, we're probably going to either incorporate a freeze into that gloss treatment, but we tend to have them come in on a monthly basis or at least every 6 weeks if we can. And then at that point, usually every other treatment or every third treatment will at least be a Glacial Rx gloss treatment.
And then I think the last question we have time for is, what types of treatment packages have you created?
Treatment packages, I mean, everything that we have is very customized. Yes, of course, we have like the standard 3 gloss type of treatment, and we space those about 4 weeks apart. Depending on how severe someone's issue is, like I also treat someone that has lupus, and she sees great improvement with like that butterfly rash that you kind of get. So those are more the standard 3 or 6 session type of packages. We incorporate 2 different versions of our gloss treatment into our monthly memberships that we have because we have 2 different tiers, as well as customizing those packages. So like I said a little earlier, we have a lot of different devices. I'm very lucky to be able to say that, I mean, I believe we have 15 at our office right now. So based upon what it is that their goals are trying to do, I always create that custom package saying, hey, you're going to get 3 laser treatments and a hydrofacial to start everything off and a gloss treatment to finish everything off. So you can kind of customize it however you'd like. And I will usually, obviously, our members get a better discount. But if they're our standard purchase package is about 15% off for most people. But include it in any of those things, whether it's before treatment or after treatment or in between those more aggressive treatments. So if you're going to do a laser treatment, incorporate it. If you want to incorporate the peel portion, maybe you have them come back a week later for that. So it's just a matter of saying, hey, what do I have? And then saying, okay, well, we're going to incorporate this at the beginning, middle, or end of each of those treatments.
Thank you, Andrew. That was valuable insight on how you are utilizing Glacial Rx in your practice. And thank you for sharing your clinical pearls and wisdom around the glacial gloss treatment. Now I would like to welcome our next speaker, Eva Pietri. Eva is a highly skilled medical esthetician whose career spans nearly 2 decades. She currently works out of Coolspa, a top Manhattan med spa owned by board-certified New York plastic surgeon, Dr. David P. Rappaport. Eva is also certified by the National Laser Institute and is well-versed in many platforms. As with Andrew, we will have a Q&A portion at the end. For this portion, please enter your questions into the chat feature on the bottom of your screen. And now I'll turn it over to Eva.
Thank you so much, Nicole. That's such a beautiful introduction. I am so happy to be part of this webinar, and I am so blessed to share my experience with all of you who join us today. So my topic is actually maximizing results with Glacial Glide. Before I go to my slideshow, I would like to tell you a little bit more about my experience with Glacial Rx and how it started with Coolspa, because you might actually relate to it as well. So we got our machine in 2021, end of the year, received the technology. We look at it, it was a great technology, had amazing possibilities, but somehow, maybe lack of training, maybe lack of excitement, we kept it in a corner and collecting dust. So it wasn't utilized as much as we would like to. I was saying to the company, Glacial Rx company, that I would love to have that continuous cooling. That will actually help me tremendously with my treatments and actually would work much better with our practice than just the standalone treatment, which was great. It's just somehow could not take it off in our practice. Glacial Rx company is very open-minded. And I tell you, like, they actually listen. Couple months, maybe, I don't know, 2-3 months after, they're coming and they're like, hey, Eva, we have exciting news for you. We have a continuous cooling. It's called Glide. 10 minutes, continuous cooling, you can use it. They gave me the cart, 10 cycles. I used that cart within 2 days. I was all done. I could not stop. My mind was just spinning. I want to combine this with everything. So my first slide actually is about my very popular treatment that I do so much at Coolspa. And probably you might know this procedure as well. It's Morpheus 8, it's very popular all over the world. But you don't limit yourself just to a Morpheus 8 combined with Glacial Rx Glide. You can combine this with all the other modalities. You might have secret RF or other microneedling devices, radiofrequency devices, or even resurfacing lasers. So as you know, radiofrequency is colorblind. So you can use on all skin types. But even with radiofrequency colorblind treatment, I still have to be careful with that darker skin tone. When we're treating fits 4 and up, we have to be super careful with post-inflammatory hyperpigmentation. To avoid that, we pre-treat the skin with hydroquinone, or I use Illuminate from Elastin company, retinol, for like a month prior to the treatment. But still, as a provider, I'm always a little bit scared. How is going to turn out after the treatment? Are they going to have that post-inflammatory hyperpigmentation? So also for lighter skin tones, are they going to have that post-inflammatory redness? People always ask for faster recovery as well. So when I combined my microneedling with Glacial Glide, I was able to prevent post-inflammatory hyperpigmentation, avoid post-inflammatory redness, reduce that recovery actually in half. I was amazed when I saw just immediately after doing my Morpheus and doing the Glide, how skin looked like. It was less redness, less inflammation, and people were, well, wow, this is actually feels great. And I tell you, like when they received that cooling after this heat, they felt so much better. And that's the only thing they remembered. When they were going home, they didn't think about the heat they had just on their skin. They were thinking about that nice cooling massage. So the protocol for this is I do a treatment of Morpheus, Morpheus 8. Let me just show you in the next slide. So one video is I'm performing Morpheus on this patient's neck and the face. She's quite comfortable as well because we do prescribe some medication. We do, because we're a plastic surgeon, we're able to take all the pain management methods. Also, she was numbed for an hour, and now she's getting this treatment. And then the next slide, let's go to the next video. Of course, you know this one. This is our Glacial Glide. On this video, I'm actually going a little bit faster there. I'm not sure, I think it's a speed a little bit, but that's, you get the point. So 10 minutes on each side, 10 minutes here and 10 minutes on the other side. So it'll be 20 minutes. Then we have pictures. I show you the picture. So over here, she had Morpheus 8 done over a year ago, back then without a Glacial Glide post-treatment. And you can see her skin, this is the next day after the treatment. She has a lot of brown spots and a lot of inflammation. She actually said that her skin was a little bit hurting her, a little bit, redness, swelling. This second picture is same patient, and this is done with Glacial Glide. This is the next day, 10 minutes on each side. I use nectar from elastin as a, for the glide. So you see, amazing. It's just her skin. She could actually go to work over here. Recovery, speed up like in half, like I would say 3 or 4 days. And sometimes after microneedling, you can also get like a small little breakouts. I noticed that if I combine with Glacial Glide, people don't get as many of those tiny little breakouts. It's beautiful. You can combine this with your Fraxel treatment, Pixel, even with CO2. I know some doctors combine. It's completely fine. And then you use a product that will that is safe to use post laser, and you just do this quite gently. Okay. Okay, so that concludes the Morpheus. This is the next treatment that I am very happy with the results. Unfortunately, I don't have photos for this one. I didn't get the consent from my patient, but it's called Fire Ice procedure. I absolutely love this one too. So this one I use XLV Plus laser from Cutera. So this one actually has 2 wavelengths. On this slideshow, I didn't put that 532, but it's a 1064 and 532, which 532 is amazing wavelength to reduce redness. It works so good for rosacea and diffuse redness, sunspots, facial rejuvenation, collagen stimulation, even bruises, surgical scars. So as you see this list, what XLV Plus can do, and you think about the Glacial Glide, it has almost the same properties. So Glacial Glide also reduces rosacea, also works for that diffuse redness because it's so inflammation, even surgical scars. So you can actually combine those 2 procedures together because they have the same goal. And you can get amazing results. with less downtime. Patient feedback on this one is faster recovery, less discomfort, fewer treatments, and better results. Fewer treatment, I actually noticed that before I will do 6 XLV plus treatments, and combining with Glacial Glide, I'm going to do only maybe 3, and they come back later on for post treatments, like a follow-up treatments. Normally will be done monthly. They will be doing as a maintenance treatment every 3 to 4 months afterwards. Of course, they can come back for different procedures in between, like, and I'll show you the next slide, which is my favorite to do. I always get super excited while I'm doing this treatment, and that's coming now. It's pairing my Glide with Diamond Glow. That's what I use. I love Diamond Glow. Facial is my favorite of all, but you can combine with your other facials. You can combine this with hydrofacial if you have, or even signature facial. Some spas, do beautiful signature facials, and they have a Glacial Rx. Don't let that Glacial Rx sit in a corner like we did before, because now you have that continuous cooling. Add it to your facials. They are amazing. People are going to love them so much. And then, of course, you're going to increase the revenue for your spa as well. But look at this. So the Diamond Glow, it's a fabulous treatment, which is, 3-in-1, exfoliates the skin, extracts and infuse with this wonderful serums. So already it's a perfect treatment. But if you combine with Glacial Glide, then you have that super facial. This is not like just a facial. It's actually a treatment without downtime, with amazing results. People after this treatment have more even tone. They experience brighter and smoother skin. They can go to work right away. They can go to events. They look beautiful. The skin is glowy. And I tell you, whoever tried the combination, the Diamond Glow with the Glide, they never go back to just a simple treatment. They want them together. Every time they're rebooking, they forget the name, so they will say, can you do that treatment with that cooling at the end? They just love it. And I think also because I love it so much, so people, I think, feel it, that enthusiasm from the provider. But also they see results, and the results are the most important. So this is my favorite treatment. And let's see if we can play this video so you will see the protocol. So that's me in Coolspa. I'm just treating this beautiful lady. A little bit Diamond Glow video. Oh, she loves it. That treatment is just so good. She has beautiful skin, so there's nothing like she's correcting. This is the mask that we use for Glacial Glide. And now, there you go. We're going to do some Glacial Glide. I'm actually on her. I just did 10 minutes because there was nothing that we're correcting necessarily on her skin. She's young, she's gorgeous. Her skin is glowing already. She just wants that pick me up. And at the end, I'm putting actually this mask. It's a hydrogel glacier cooling mask. So goes off and her skin just looks fabulous. So make sure after this treatment, you do not massage any further. I do give a shoulder massage while they're in a mask, but do not stimulate that heat back, because after Glacial Glide, we want to keep that skin cool, and we want Glacial Glide to actually work. So keep it cool. So this is my favorite treatment, Diamond Glow with Glacial Glide. It's called Glacial Glow. Okay, so here we are. So this is my last slide. This lady, so her story is, she came to our office with a severe redness, painful skin, swollen eyes. I am not a dermatologist. I cannot diagnose. So that's why I put eczema dermatitis, because I don't know. She even didn't know herself what she has. But she came in, she says she has this painful irritation on her skin. And I was like, well, what can I do for you? What can I possibly, I'm an esthetician, I'm not a doctor. I don't know if I can touch her skin with anything. But then I have this aha moment and I'm just like, wow, Glacial Rx is FDA cleared for reduction of pain, inflammation, and swelling. What do we have here? Exactly, inflammation, pain, and swelling. This lady has so much heat on her skin. I said to her, well, let's give a try. Let's see what we can do for you. Let's give a try with Glacial Glide. We'll do 10 minutes on each side. And might help you, might help, maybe not. But I gave a try. I really hoped for the best. So the protocol for this treatment was I use elastin nectar, 2 pumps for the glide, 10 minutes on each side on her face. And then she came back 2 weeks after. She took also nectar home, and she had a LED light at home like a mask. And she asked me if she can use it. I said, please do, no problem, you can use it. 2 weeks after she came back, we did another treatment. And 2 weeks again, she came back, that was a month, with that beautiful clear face. So tell me, this is like, I was so amazed. I could not even believe how amazing this treatment worked on her. We both cried because, that was just so life-changing. And, is she cured? She's not. She gets a little bit flare up here and there, and she comes back monthly now. And I told her, if anything comes back, please come. We will treat you. This is working. She loves it. She loves it. And the other thing I noticed on her too, actually, her pigment under the eyes, because she had like a pigmented eyes over here and then a little bit brown spots. This also is getting better. So not only that inflammation, the redness, but also the dark spots are getting better and her skin is getting clearer. So there are more benefits of it. So we went after that eczema or dermatitis, and now we're getting even more results. When she gets better, we're going to probably work with the freeze on her a little bit, just to correct some of the brown spots that she has a little bit on her cheeks. I'm like looking forward to really take her skin to the next level. I'm super happy with this procedure, and I just love Glacial Glide. I believe in this company so much, and I just hope that everybody who is on the call today, who's watching this webinar, is going to learn something from me, and I am so happy to share with you. And if you please have any questions in the future even, please take my email and you can always send me those questions. I would love to help you. I hope you can include Glacial Glide in your practice even more so now. You can combine with all these different modalities that you do, because the end of the day, this is our mission as estheticians, in this medical field. We are there to help people, especially when we're doing these laser treatments. We want to help them to recover faster. We want to give them as best as possible results. And also we want to make sure they have best skin care and best post care as well, so they don't have this post-inflammatory hyperpigmentation. So this is our job, to take care of people, and we have to recommend treatments appropriate to their skin and help them with Glacial Glide to avoid possible side effects. And I believe, maybe that's a huge trust in the product, but I believe Glacial Glide is delivering this. And I thank companies so much, the Glacial Rx, for giving us opportunity to work with them. And they trusted in Coolspa that we will take this technology to the next level. And I think we will. I think we definitely can do our best, and I can help. So thank you so much. If there's any questions, please ask. Thank you.
Thank you, Eva. Thank you so much. That was fantastic. We appreciate you sharing your insights with us. We do have a couple of Q&As, a little Q&A session here. We do have a couple of questions that popped up in the chat while you were speaking. So let's go ahead and start with the first one here. So are you using Glide post-fractional or post-microneedling?
So I don't have a fractional laser, but I do use after Morpheus resurfacing. That will be fractional. I do use it. So same way, I perform first Morpheus regular microneedling, then I do skin resurfacing with Morpheus, and then I put nectar, and I perform 10 minutes on each side because that treatment is way stronger. But if I did have a laser skin resurfacing, let's say if I had a Fraxel or if I had a Pixel from Alma, that I would use it together for sure. I do use it with my Clear and Brilliant, which is like a mini Fraxel, and people absolutely love that treatment because that one, the Clear and Brilliant, actually is amazing combination with Glide as well, because the Primea helps with the pigmentation and then Glide helps with the pigmentation as well. I didn't have this on a slideshow, but that would be an awesome combination. So yes, use it please with resurfacing treatments.
So the next question is, are you using PRP or exosomes as a Glide agent sometimes?
Yes, but PRP was very difficult to use as a Glide. I tried it once because PRP, as you know, when you put this on your face, it dries it super quick and become clumpy. So under the cold, it just doesn't work. As I did it before, the person had a little bit extra time that she could stay in a clinic. So she did have PRP, put it on. She stayed in a clinic for a little bit longer. I basically went and I did different treatments at that time. She was there for like 30 minutes when I applied the PRP. Then I came back, and on top of PRP, because everything was already absorbed, I put a little bit nectar, and then I was able to do Glide over that. But just on the PRP, it just doesn't work. It's just too dry.
The next one is, which patient type would you use Glide as a standalone treatment?
Which patients I would use just the Glide?
Yeah, just as a standalone.
So patients like my last one who had that eczema, dermatitis, then I would just do the Glide. People who even have like, let's say, any like rosacea and they do not want to do laser treatments, because I have some patients that they're a little darker skin and I cannot use maybe 532 because they're darker, then I will only use the Glacial Glide. But usually I combine treatments together. For most of my treatments, I always try to do two modalities. I'm like very well known for combining different modalities together. That's how I get the most results. But when I have somebody with super sensitive skin, that Glide will be perfect.
So another question is, how has Glacial Rx changed your patients' outcomes that you were previously less able to achieve?
Of course, yes. So in New York, people don't have time for recovery. They just don't. They want to get a treatment Friday. They want to be back to work on Monday. So when they were getting Morpheus 8, often they couldn't be ready on Monday or even Tuesday. So with the Glacial Glide, they have that opportunity. So Glacial Glide speeds up the healing process tremendously. So they still may be recovering a little bit, but it's way less inflammation than it was before. So that's one. Second one, that post-inflammatory hyperpigmentation, that was always in back of my mind. So better for patients, also better for me because I don't stress as much. knowing that they are safe. So it's like a security blanket a little bit too. So that would be one. Second, that third actually point is that people getting better results. When I combine those two modalities together, they're getting better results. And I couldn't achieve that before. Maybe I had to do more treatments. So I'm saving money for people, I think, overall. But we're also making the money for the practice because we're making the treatment more expensive. So yeah, that's probably all.
Okay, great. And then one other question, similar to the question Andrea actually got previously, which is what types of treatment packages do you offer?
So the packages, we do have Morpheus, like a package of 3 that will come with 3 Glacial glides. The other package is the Diamond Glow with Glacial glide. That's called, Glacial Glow. So that package. We have some other combination therapies like the packages of Clear and Brilliant that comes with some Glacial treatments. So that's mostly like a three of each I usually combine.
All right, Eva, thank you so much. That's it for the Q&A session here. And, I want to thank you, Eva, for such a great discussion and for highlighting some of your best practices when using Glacial Glide modality. As we come to a close today, I want to thank both of our speakers for their time and for sharing their experiences with the group. Also, thank you to all the attendees. We know that your time is valuable and we appreciate you spending some of it with us. If you'd like to learn more, please go to glacialskin.com and click Become a Provider, or if you're a current customer, please reach out directly to your practice development manager. Thanks again, everyone. Appreciate it.
Thank you so much.